Hey future doctors, welcome back to our channel Teddy Guides You. This is Harshita. So today's topic of interest is herpes zoster ophthalmicus. Okay, so there are majorly two viruses. First one is HSV virus, second one is HZO virus. So these are the two important viruses that affects the eye. Okay, so now let us discuss about herpes zoster ophthalmicus. So what is the etiology here? Etiology is virus, which is varicella zoster virus. The type of virus is DNA virus. And the nature is it loves nerves. So here you will see neurotropic. So there will be involvement of nerves in this case. Okay. So what is the pathogenesis like? How does it happen? How the virus is getting invaded into our eye? So the pathogenesis is first you will see infection. Infection is mostly seen in childhood, which causes chickenpox. I think you are aware of this. Next one, it undergoes dormancy, which is silent phase, and it hides in the trigeminal ganglion. And due to immunosuppression conditions, it reactivates and travels along ophthalmic division of trigeminal nerve, and it affects the eye. Okay, so what are these immunocompromised states? They are AIDS, cancer, tuberculosis, transplant patients, etc. So what are the clinical features that you will see here? So they are skin rash, pain. The pain will become severe, plus you will also see vascular rash on the forehead, eyelids and nose. And the important sign is Hutchinson sign. Here you will see tip or the side of nose has vesicles, and eye involvements can also be seen here. Here the rash is unilateral, always seen one side of the midline, and as we already discussed, it is neurotropic. There will be neuralgia like burning pain, along which cranial nerve 5 supplies. Okay, so these are the clinical features. So what are the phases here? So the phases are divided into 3 types like acute phase, chronic phase and relapsing phase. In acute phase, you will encounter fever and malaise, and you will also find skin lesions like vesicles, which develops into pustules and which develops into crusting ulcers. And here you will see ocular involvements, which leads to conjunctivitis, keratitis, episcleritis and uveitis. These all are infections, and they further leads to secondary glaucoma and optic neuritis. Second one is chronic phase. This chronic phase, the duration of time is months to years. Here you will see post-herpetic neuralgia, like there will be severe pain. So the hint is pain never leaves, and you will see ptosis, trichiasis, which is associated with the eyelashes, notching and ulcers, and you will also see persistent infection to the cornea and uvea. So these are the important clinical features that you will find in chronic phase. And the next one is relapsing phase, which is seen years later, in which you will see episcleritis, scleritis and secondary glaucoma. Let me know in the comment section what are the differences between scleritis and episcleritis. Okay, so those are the clinical phases like acute phase, chronic phase and relapsing phase. Next one is ocular complications. Ocular complications may be keratitis, in which you will see epithelial keratitis, pseudodendritic ulcers, like the ulcer will have dendroid-like structure, and nummular keratitis, which is like coin-like granular depositions, etc. And other eye issues are uveitis, trabeculitis, uveitis. There will be inflammation of the uvea, which contains iris, ciliary and choroid, and trabeculitis. There will be inflammation of the trabecular meshwork. Because of the inflammation in the trabecular meshwork, there will be stoppage of the outflow of the fluid, which leads to the secondary glaucoma, and scleritis and episcleritis and optic neuritis and retinal necrosis can be seen in HZO keratitis. Okay, up to now you get some information about this disease. Now what is the treatment? You will all say antiviral drugs. Yes, of course. First, early antiviral therapy should be given for better recovery. They are divided into 2 types like systemic therapy and the local therapy. In systemic therapy, you will give antivirals like acyclovir, valcyclovir, and to control the pain, like here we discussed that pain never leaves. So for pain controlling, you will give naturally NSAIDs, And if the pain is severe, you will also give opioids. And steroids are only given in case of severe cases because he is already immunosuppressant and steroids will decrease the immunity furthermore. Okay, so steroids are given only the situation is very worse in our hands. And the steroids are high dose prednisolone for optic neuritis or nerve palsy. And others you will give amitriptyline, which is tricyclic, which are TCS, and cimetidine like H2 blockers, etc. And for local therapy, you will go for eye and skin, like for skin rashes, you will give antibiotics plus steroid ointments. And for eye involvements, you will give topical acyclovir, steroid eye drops for severe conditions, cycloplex. Let me know in the comment section what percent of atropine gives rise to cycloplex, and Timolol, which is beta blocker for glaucoma. And for persistent ulcer, you will give lubricant, bandages, contact lenses, and the surgery option is tarsohaphe to protect the cornea and keratoplasty in case of severe corneal scarring. So these are the important things that you should remember as an ophthalmist. Okay, so hope this video helpful. Consider subscribing to the channel Teddy Gets You for more interesting videos like this. Let me know in the comment section that what are the classes that you are expecting from this channel. Hope this video helpful. This is Harshita signing off. Thank you so much.